Dr. Tim Nicholl here, coordinator at Maximize Chiropractic. Today we're going to talk to you about fractures. Now, some of you are thinking of, hold on a second, this guy broke his back and you're going to be adjusting him? Absolutely. Today, later on, you're going to see Kyle getting adjusted in person, but I want to walk you through how healed fractures that without surgery are still very safe if you know what you're doing. But there's also things, if you don't know what you're doing, is very dangerous, so that's why you should go to a licensed chiropractor. When we look at the side view of the spine, the bone right here, the disc right here, the bone right here. When the bone is affected, you will see an adaptive response with the bones fusing themselves naturally together, the discs thinning out because of lack of movement, and what it will have is a contributing effect on the actual nerve itself. If you've had trauma to your spine, the worst thing you could do is ignore this, because the body's adaptive response will start to fuse the bones and cause irritation to the nerves. Instead, you can have individualized care. The problem with a lot of things, chiropractic, medication, most doctors, is that there is a standard for everyone. It's like ibuprofen. There's one pill for every condition. So the reason why not everyone does amazing with ibuprofen is that each person's different. You got to individualize the care that you get, and it first starts off with very specific x-rays. When we look at this condition, you would not see this broken bone from the front, but a trained eye would see exactly where that fracture is. And here's the thing. This is an adaptive response. This gentleman is 27 years old. His fracture happened about 8 years ago. His body is adaptively responding. Now that we have this, we can work on improving his mechanical and structural performance so that as this gentleman ages, his spine doesn't worsen like most of our spines do as time progresses.